this video, we will briefly discuss the eyelid anatomy. The eyelid skin is the thinnest skin in the human body. It is composed of epidermis, dermis, and specialized adnexal structures. Understanding its microanatomy is essential for diagnosing eyelid lesions and tumors. The epidermis is composed mainly of keratinocytes. It also contains melanocytes responsible for pigmentation. Langerhans cells are involved in immune function, and Merkel cells act as mechanoreceptors. The epidermis consists of 4 layers: the stratum corneum, stratum granulosum, stratum spinosum, and stratum basale. The cells migrate from the basal layer towards the surface, undergoing maturation and differentiation. The stratum corneum is the outermost layer. It consists of flattened keratinized cells without nuclei and provides protection. The granular layer contains keratohyalin granules. The prickle cell layer consists of polygonal cells connected by desmosomes, giving a spiny appearance. The basal layer consists of a single row of columnar cells. These cells are mitotically active and receive melanin from adjacent melanocytes. The dermis is much thicker than epidermis. It is composed of connective tissue and contains blood vessels, lymphatics, nerves, fibroblasts, macrophages, and mast cells. The dermal papillae interdigitate with downward epidermal projections called rete ridges. In the eyelid, the dermis lies directly over the orbicularis muscle. The eyelid contains multiple adnexal structures, including sebaceous glands, meibomian glands, glands of Sees, glands of Mole, and eccrine sweat glands. Meibomian glands are modified sebaceous glands located in the tarsal plate. They secrete meibum, which forms the outer lipid layer of the tear film. Now, let's look into some common clinical terminologies for lesions. A macule is a flat area of discoloration. A papule is a solid elevation less than 1 cm. Vesicles and bullae are fluid-filled lesions, with bullae being larger. A pustule contains pus. Crust refers to dried exudate. A nodule is a solid lesion more than 1 cm. A cyst is an epithelial-lined cavity. Plaque is a flat elevated lesion, and scale refers to shed keratin. Now, let's look into some histological terminologies. Atypia refers to abnormal individual cells. Dysplasia indicates disordered cellular architecture. Hyperkeratosis is thickening of the keratin layer, while acanthosis is thickening of the prickle cell layer. Dyskeratosis refers to abnormal keratinization occurring below the epithelial surface. Parakeratosis is the retention of nuclei in the keratin layer. Eyelid lesions are classified as epidermal, adnexal, or dermal. Benign lesions usually have uniform color, slow growth, and no ulceration. Incisional biopsy removes part of the lesion for diagnosis, while excisional biopsy removes the entire lesion. Treatment options include surgical excision, marsupialization, laser, or cryotherapy.